Hello guys, my name is Kushal. I am studying in Volgograd State Medical University of Russia. So today we'll be discussing the topic about Cushing syndrome. So what is the Cushing syndrome? It's generally the increase in the cortisol levels in the body which causes the obesity in the person and other clinical features also. So we will see one by one. So let's start with the introduction. So first of all, we will see there will be increase in the cortisol levels in our body after waking up early in the morning. In early in the morning, the cortisol level will start to rise. It will be after 6 a.m. The cortisol level will be start rising after 6 a.m. and it will be generally increasing about 10 a.m. So there will be a peak level in the cortisols at the time of, just a second. So here pay the attention guys that 75% of the cortisol is increased in early in the morning. In early morning. Within the time period between 6 a.m. to 10 a.m. So we will see the causes of increase in the cortisol level. Generally why the cortisol level is increased in our body. So there will be 4 general reasons. So first reason will be increase in the steroid intake. Some patients are prescribed steroids, so they will be taking steroids. Some of the patients even don't know whether they are taking steroids or not. They will be just taking some Ayurvedic medicines and it will be having the content of steroids. So they will come to you and say that, sir, my weight is increasing. The patient will come to you and say that weight is increasing. They are having high blood. Their parents are not having any kind of chronic diseases like hypertension and diabetes. Still they are having the obesity and high glucose level in their blood. So why is it? So there will be increase in the level of cortisol due to intake of steroids. So we have to pay the attention that increase in cortisol level will be there and decrease of the ACTH will be there. As soon as the cortisol will increase, by the feedback mechanism, the ACTH will start decreasing. The second reason for increase in the cortisol level is pituitary adenoma. Due to the pituitary adenoma, the ACTH will be increased, and due to the ACTH production increase, the cortisol level will be also increased in our body. So you have to pay the attention why the ACTH level is increasing due to pituitary adenoma. Third one is the ectopic production of the ACTH due to the carcinoid tumors. The carcinoid tumors are responsible for increase in the ACTH. So as you have to pay the attention also here that as soon as the ACTH level increases, there will be a clinical presentation of the hyperpigmentation in the patient. So palms and soles, there will be hyperpigmentation. There will be blackish coloration because when the ACTH production increases, it will increase the melanocyte secretion, or it will increase the content of melanocyte or stimulate the increase in the hormone of melanocyte. So it will cause the hyperpigmentation when there will be increase in the ACTH level, which will be due to carcinoid tumors and pituitary adenoma. The fourth cause will be adrenal adenoma, which is directly acting on the zona fasciculata layer of that is the second layer of the adrenal gland, due to which the cortisol is which is responsible for the secretion of cortisol. So when there will be adenoma, the cortisol level will start increasing. And you have to pay the attention. There are 2 things where the cortisol level will be increasing and there will be no increase or not any feature of ACTH increase. They are intake of the steroids, and secondly there is adrenal adenoma. The other 2 causes will be pituitary adenoma and the carcinoid tumor. This also increase the ACTH. So there will be hyperpigmentation seen in this patient. So these are the etiological causes of increase in the cortisol level. So we will shift towards the clinical features. Well, what will be the symptoms and what will be the signs in a patient which will represent they are having the Cushing syndrome. First one will be they will be having obesity. There will be centripetal obesity. Their structure of the body in the middle part of the body will be like fatty structure, and secondly they are having thick neck. They are having thick neck, and there will be their peripheral limbs and limbs will be thin, and they are having obesity in their center, so it's called as centripetal obesity. Secondly, there will be hypertension, because you will see it further that Cushing syndrome, increase in cortisol level will increase your salt and water retention, and it will start excessive excretion of the potassium and hydrogen ions, so it will cause hypertension. Thirdly, there will be presentation of bruises will be seen of violet and purple color. Proximal myopathy will be seen. What is mean by proximal myopathy? Like you and me guys, there we are normal, we are having no problem in getting up when we are laid down or sitting on the flat surface, but the person who is having Cushing syndrome, he will be having difficulty when he is getting up from a flat surface. It is called as proximal myopathy. Then also the centripetal obesity is known as lemon on stick appearance. It will be represented as lemon on stick. So we will see the factors which affects in when the cortisol level is increased in our body. So first thing is that there will be impaired glucose intolerance, because the glucose level will be increased in the person who is having Cushing syndrome. So when the person is having Cushing syndrome, his cortisol levels are increased, and due to the increase in the cortisol level, there will be increase in the glucose intolerance. So first one is that when there is fasting blood sugar is more than 126, it is considered as impaired glucose intolerance. If 2 hours after the post meal, if the sugar level is more than 200 mg per deciliter, it is also considered that as blood glucose intolerance, and the treatment of choice is metformin. So the second cause of second thing which is affected in our body due to the increase in cortisol level is it activates the epithelial sodium channels in our body. Due to the activation of epithelial sodium channels, there will be increase in the sodium ions in the body, so salt and water retention will be there, which is primary cause of increase in the blood pressure in our body. And secondly, urinary loss will be there. Urinary loss of potassium channels and potassium ions and hydrogen ions will be seen. It is also called as hypovolemic alkalosis, you can see here. Then it activates the sex steroids. So the person will be having, if there is female patient, she will be having high sex hormones. So the facial hairs can be seen. The drug of choice for facial hairs will be eflorenthin for a woman who is having hirsutism, and she will also have infertility, she will have weight gain, oligomenorrhea will be seen in the patient. So let's shift to the diagnosis of the Cushing syndrome. So it will be screening test, 24 hours urinary cortisol level will be increased. There will be spotting of the salivary cortisol level, which will be increased. Or overnight dexamethasone suppressed test is given, guys. So what is the reason for dexamethasone suppressed test? When the dexamethasone is given, if there is increase in the cortisol level, it will generally decrease. But in the factors like carcinoid tumor of the lungs, the cortisol level will be not decreasing after the prescription of dexamethasone. So investigation of choice will be low dose of dexamethasone, which is called a suppression test, 0.5 milligram for 6 hours for 2 days. So investigation of choice will be CT abdomen and the MRI of head, which will we can see the pituitary adenoma. ACTH dependent Cushing syndrome will be diagnosed in that. ACTH will be increased or decreased. We have to see whether, if there is pituitary adenoma, we have seen that if there is pituitary adenoma, the ACTH level will be increased. So we'll see the treatment plan for the Cushing syndrome. Basically, there are 4 etiological causes, and there are 4 different etiological treatments which are used for the treatment of the Cushing syndrome. So first one is oat cell lung carcinoma. For the oat cell lung carcinoma, we'll use the chemotherapy, which is cisplatin and irinotecan. Irinotecan and cisplatin combination will be used as a chemotherapy for oat cell carcinoma. Second etiological factor is intake of steroids. So the person who is taking steroids from a long time, we can't discontinue the steroids suddenly, because there will be sudden crash of the BP in the person, and there will be other side effects if we stop the steroid intake suddenly. So there should be a gradual decrease in the steroid intake of the patient. So taper the dose of steroids in the person. Start alternate steroids, for example azithromycin. So we can also start the alternate steroids, or otherwise we have to decrease this dose of steroid. For example, if the person is having 60 gram of dexamethasone, for example, consider dexamethasone, 60 gram of dexamethasone, we should take the gradual decrease in the dose, like 30 or 40 milligram of dexamethasone. The fourth cause is pituitary adenoma. So for pituitary adenoma, we have to do the surgery, that like transsphenoidal surgery. And fourth one is the adrenal adenoma. So for adrenal adenoma, there will be increase in the blood pressure. So for if you are doing the surgery while removing the adrenal glands, so we have to prescribe some medication before doing this surgery. They are given as follows: metotican, metapyron, and there will be, for adrenal adenoma, before doing the surgery, there will be prescription of some kind of medication like metotican, metapyron, aminoglutamide, and oral ketoconazole. Yes, ketoconazole is a antifungal medications, but it is also used for while doing the adrenectomy. So thank you guys. Here we discussed all the clinical features, etiological causes, diagnosis, and the treatment of Cushing syndrome. Thank you.